Welcome, everyone. Thank you all very much for being here on this cold November night. Welcome to History Café, Community Health Centers and Medical Access. I'd also like to thank those attending via live stream and here in person. I'm Sora. I work here at MOHAI in public programs, and to give a visual description of myself, I am a white and East Asian person wearing silver glasses with long brown hair and a keffiyeh. A few housekeeping notes before we begin. History Café as a series is presented in partnership with HistoryLink on the third Wednesday of every month. HistoryLink is a wonderful resource as the largest free online encyclopedia of Washington state history. If you need a restroom, they are just beyond the deli case in the cafe to the left. To give a little run of show, we'll have a great discussion here with our panelists, followed by some audience Q&A, with the event wrapping at around 8 p.m. As we ground in the space, it's important to acknowledge that here at MOHAI, we are on the historic and contemporary lands and waters of the Suquamish, Duwamish, Muckleshoot, and all Coast Salish people. Historically, Native communities were forcibly removed from this place, with lasting impact on the land, water, and people. Therefore, it's critical that we all hold deep respect and gratitude for their unbroken stewardship of this place. We encourage you to visit the websites and cultural institutions of local tribes to learn more about the people whose land you're on and how you can support their sovereignty. Now, to introduce tonight's speakers, we have a really wonderful group of panelists here. Teresita Batayola is the President and CEO Emeritus of International Community Health Services in Seattle. ICHS is the state's largest Asian and Pacific Islander primary care health services nonprofit organization. Teresita is also on the Seattle College's Board of Trustees and was on President Biden's Commission on Asian Americans, Native Hawaiians, and Pacific Islanders. Jesus Sanchez is the Senior Vice President and COO Emeritus at CMAR Community Health Centers, one of Western Washington's largest providers of health and human services, with the mission of serving low-income and uninsured people, specializing in services to Latino communities. Jesus also has a long career in public administration for Washington State and King County. And finally, Tom Byers is the retired co-founder and former executive director of Country Doctor Community Clinic, a clinic founded through the anti-war movement and one of Seattle's first clinics to welcome HIV-positive patients. Tom is also a member of the board of Seattle Parks Commissioners. He is a public affairs consultant and served as deputy mayor for 2 former mayors. Please give them a warm round of applause. So to kick it off, I know that I gave a little intro for each of you, but I was wondering if you could tell me a little bit about your personal backstory and how you came into this work around organizing for healthcare. Teresita, if you'd like to start us off.
Sure. So I am an immigrant. In 1969, my family came to the United States from the Philippines. My father was an engineer, aeronautical engineer, and he had hopes of working for Boeing. And so we arrived that July, and it was the same month when Boeing lost the SSD contract and plunged Seattle into a very, very deep depression. And the city emptied out, and there were signs, a billboard sign that said, "Will the last person out of Seattle please turn off the lights?" So I say that because here we were an immigrant family hoping for a much better life, and we had to really scrape and figure out how to survive. My parents were very strong Catholics, and they, in spite of the hardships, they started volunteering in the community. And around the same time, so 69 on to the early 70s, there was a lot of unrest in Seattle because people were really pushing for civil rights. It was the Vietnam War era, and there was a lot of anti-war sentiment and demonstrations. And in the Chinatown area, people were angry because there was going to be a sports stadium, the first major sports stadium. And Chinatown had already been cut off and divided by the freeway, and here was a major sports stadium, the Kingdom, which it came to be. And so there were huge demonstrations also in our community, basically saying hambaos, which is a pastry with meat in it generally. Hambaos, not hot dogs. And at the same time, the community had discovered a lot of elderly men living in single-room occupancy hotels. And they were laborers who came here to do migrant work in the farms, who did work up in Alaska in the fishing industry and the cannery industry, lived hard lives. And because of the unique status of Filipinos, Philippines being a colony of the United States, they were not allowed to bring in women. So they had aged by themselves, and the community was aghast that people were dying, people were very sick, and they had no one caring for them. So the grassroots movement of creating a clinic, creating some social services, at the same time fighting King County for a kingdom because the community believed that it would decimate the community further, basically crystallized into this huge movement in our community, a community that was usually silent because you don't see Filipinos, Japanese, and Chinese, which was the Asian community at that time, really coming together, really going on the streets, really demanding anything. So my parents, who were volunteers, basically dragged me. You know, here I was, a teenager who was like spiteful, rolling my eyes, angry at being separated from my friends. And they had me volunteer under this nun who was a nurse practitioner, a very early nurse practitioner. And she was trying to do a nursing program to help out the seniors. So that was the beginning of my involvement. And through the years, I continued to be engaged and volunteer in the community until eventually I went back to the community health clinic, which had grown, and became its CEO.
That's amazing. Thank you very much. Jesus, would you be able to tell me a little bit about your personal connection to this work and how you became involved?
Sure, certainly. Good evening. My name is Jesus Sanchez. And not unlike Teresita, you know, I also came from a migrant working family, lived in the labor camps of the Yakima Valley, grew up in the Yakima Valley labor camps, and then finally raised enough money to buy a small home. My parents did. My father died in a farm working accident, so we were asked to leave from the labor camp to make room for our working family. So at that point, we were able to find a home. It was a burned out church, actually. We later found out that it had been a church that had burned, but we fixed it and turned it into a home, which was a blessing, I think, in many ways. But basically, my interest in this programs of healthcare and industry, of building something, but really didn't come into fruition until after 1968, which is right about the time that this families were coming into the area. But let me tell you a little bit why I'm involved. In 1968, I'll tell a little bit of story about this because it's very important. In 1968, we were standing and sitting around in the porch of my mother's home. And there was this young man coming down the street, and we saw him, and he was an African-American black student that was walking down the streets. And nobody knew who he was. My gang, quote, East Side Latinos, were all sitting at my mom's house on the porch. And one of them said, let's go beat him up. We don't know who he is, let's beat him up. And I said, no, we're not going to do that. We're going to see what he wants, and then we'll beat him up. And so he came to the house and looked at us and said, any of you guys graduate from high school? And 2 of us out of the 13 raised our hands, yes. So I said, yeah, what about it? He said, well, would you like to go to college? And I said, what? Go to college? He says, yes. I had just graduated from high school in '68, and I said, yeah, I'd love to go, but I don't have any money. He says, well, we'll offer scholarships so we can get you there. Well, years later, this person was Mr. Larry Gossett, former King County Council member, and my hero in many ways. And Larry Gossett, and I became lifelong friends after that. I was with 5 more Latinos. We were the first 5 Latinos to enter the University of Washington in 1968, recruited by Larry Gossett. And then I became a member of the Black Student Union because we did not have a Latino student union at that time. And it was great because I got to know E.J. Brisket, I got to know a lot of the advocates for education. Larry Gossett was a mentor of mine and someone that I looked up to all these years and still do. But what that means in the story about that small piece of that is that it gave me an opportunity, it opened a door to create a sense of equity and balance for Latinos to get involved in education and break out of that mold of poverty and maybe make a change in life that might better even our communities through whatever contributions I can make. So years later, here I am now working in various different locations and gone on to college. And then one year, my mother, who I worked with for many years picking apples in the farms of Yakima, my sisters called and said, guess what happened? I said, what happened? She said, my mom fell. I go, what do you mean fell? She said, yeah, she fell off the ladder picking apples and broke her leg. She was 62 at the time. And we all said, that's wonderful. That's great. Because for years we've been trying to tell my mother, stop working, Mom, we can take care of you. But she refused. She wanted to keep working. So we were kind of happy that she broke her leg because she wasn't going to work anymore. But here's the key piece to that. Finally, there was a clinic that she could go to all these years, and it was a Yakima Valley Farm Workers Clinic. Now, all the years that we've been growing up, we were only going to health care when we were at death's doorstep. Why? Because we couldn't afford health care. As migrant farm workers, all we cared about is if you're sick, you got a cold, you go to work. And you work your cold through the day. You work your flu through the day. But if you're really, really sick and you really think you're going to die, we're going to take you to the doctor. And that's when we went to the doctor. And only then, but it was very rare. We sought support from even our communities to find out what kind of cures they have. One example of a cure in our family was if you got a deep cut, my mom would send me underneath the house and crawl there and look for as many spider webs as I could find, and then we would put that in the wound to coagulate the blood. And it was like a Band-Aid. And that spider web is what I would use when I got cut. I'd run into the house and get some spider webs and rub it into the wound and stop the bleeding. It was temporal, but it was actually from what I found out a millennia years later, that spider webs actually have some sort of medicinal quality about it. Believe it or not. So those are the things we used. But when Yakima Valley Farm Workers came into being, my mom at 62 for the first time decided to start going to healthcare, getting treatment, getting the support she needed. And the amazing thing is she lived to be 103 years of age. She just died in 2019. She got health care and went to health care regularly and extended the quality of her life. There were so many times when we thought she wasn't going to make it, but she went to the health clinic and got all the treatment that she needed. And I said, this is amazing. So when CMAR came into being in 1978, this is a history of CMAR. CMAR began in 1978 under the same purpose and under the premise that there is a need for community health care for Latino communities, like my mother, that needed to be also available in the northwestern part of the state. Yakima Valley Farm Workers was a model for what we decided, we meaning the Latino community, because Rogelio Riojas, the founder, and his community leaders that they began, I wasn't part of that initially, but he and a number of health students from the health department at the University of Washington and other community leaders decided to open a clinic in 1978 and began CMAR. Now, people wonder why CMAR, the name. C is obviously ocean, and mar also means ocean in Spanish. But what it really meant was we were hoping to expand. So we're hoping to expand as far as Seattle and Marysville. So Marysville became kind of MAR. But over the years, it became CMAR. And it really kind of nice to have those two words because they mean the same thing. But CMAR in itself had a vision. But it was that vision came from that need that said there is something wrong when communities of color and communities, poor communities, 200% under the federal poverty wage can't afford. We have to do something. And that vision then turned into a plan. And it was executed by these individuals, Rogelio and his group of folks that began this. And now it's in fruition for over 45 years. My involvement came into play after CMAR began. I actually worked for CMAR in 1983 for a number of years, a few years, and then I left to go into public administration, which was my passion. But my other passion that I have, and I also call it a happy burden that I carry. A lot of Latinos, when we go to bed at night, we go to bed with burdens, not just the burden of taking care of our home, our families, but the burden of bettering the life of others. How do we extend and expand the quality of life for communities? And so it's kind of a need, a necessity that we have to deal with. And for me, I've been a volunteer with CMAR now as a result for over 30 years, raising funds for education. We started off trying to raise about $10,000 a year to give to scholarships. Today, we raise nearly $500,000 every year, and we give it all away for scholarships for students. And we've had many of these students become doctors, become dentists, come back as nurses, and even go on to become architects and engineers as well. It's an amazing thing that has happened all these years for all these young people that have come on and come to work for CMAR as well. Others have gone to their communities to be doctors in Quincy and Ephrata and Yakima and those areas. So it's been an amazing transformation. So healthcare is a necessity. And so my interest and my passion has been to serve and to support Rogelio in his passion and his vision. And I'm just a servant of his in many ways. And he's also, this is public, but I'll say it, he's my hero too. We're both the same age, but he's my hero in the sense that I really look to him as an amazing individual who gives so much commitment to community.
Thank you, Jesus.
Mm-hmm.
Very powerful.
Thank you.
And Tom, I would love to hear about how you became involved in the work of healthcare.
Sure. I'm Tom Byers, pardon me, and I have a tremor that sometimes makes my speech difficult to hear. So if it gets garbled and you miss something, raise your hand and I'll take another crack at it. I grew up in a working class family back east, got traded from my parents to my grandparents quite a bit when my mother was dealing with mental health challenges. And so I kind of had a bicultural upbringing. If you know anything about the mountains of North Carolina, it's a very different place than upper Michigan. And, so I had some exposure to what Appalachia was like and what people there were dealing with at a young age. I was the first in my family to go to college. I got a scholarship to Cornell. Cornell was a hotbed of the anti-war movement in the late 60s and early 70s, and I ended up dropping out and coming to Seattle to organize Boeing workers like Teresita's father against the Vietnam War. The only trouble was by the time we got to Seattle, there weren't very many Boeing workers. They'd laid off about 2/3 of their workforce. So being good organizers, we went to the University of Washington, where I met Larry Gossett too. And within about 2 months of getting to Seattle, I wound up under indictment for conspiracy. I don't know how many of you remember when we took over the I-5 freeway after Kent State. and I and 7 others were indicted for that. And I ended up spending a few nights in jail after the indictment, and that one of the ironies of that is the holding cell where I was being held years later when the building was remodeled was Larry Gossett's office. During the time I was awaiting trial, I was approached by a couple of other people in the anti-war movement. One fellow named Gino Gianola had been a medic, a corpsman in Vietnam, and he came back to Seattle with a fierce determination to use the skills that he'd learned in the military to benefit the people who were in need in Seattle during the Boeing recession. But when he tried to apply to use his skills in some way, the only job he could find was as a cast technician at Children's Hospital. So he was frustrated by that limitation and believed that there was a better way to provide health care than what he was seeing around Seattle at that time. He met a woman named Elizabeth Nucci, who was working at Furlan's hospital at that time with disabled children, and had a lot of the same ideas. They were both relatively shy people, and they wanted somebody who wasn't shy to be their organizer. And they determined that I wasn't shy, which was true at the time. And so we set out with a couple of other people to try to create some kind of community clinic. And at that time, Country Doc is often thought of as the first community clinic in Seattle, but it wasn't. There was the Open Door Clinic that dealt with young people and youth culture and that kind of thing, located in the University District. There were also clinics popping up in the housing authority communities that weren't really on the radar screen of very many people, but they were very important to the people who lived in Yesler Terrace and Rainier Vista and High Point and Georgetown. And the ringleader behind all of these clinics was a doctor at the university named John Green, who was a neurosurgeon. And he was a very powerful, charismatic character. And one of the clinics that he helped organize was organized by the Black Panther Party. When it was founded, it was called Sidney Miller. It later became Carolyn Downs. Mm-hmm. And when we were looking for how to create a community health center, we called upon Dr. Green, and we called upon the Black Panthers, and we called upon the United Indians of all tribes, who were setting up a clinic for Native Americans at the Public Health Service Hospital, which is that beautiful building on Beacon Hill that now is called Pacific Tower, but it was then a Public Health Service hospital that served merchant mariners, fishermen, Native Americans, retired military. And this collection of federal beneficiaries of the hospital became very important to us later on for reasons that I'll get to in just a moment. But we called upon those clinics that were already operating and got a lot of good advice from Elmer Dixon, who was the chairman of the Black Panther Party and trying to run a medical clinic on 20th Avenue in a house that served as the headquarters of the Panthers and in the evenings as a clinic. But when we went there to visit, there were sandbags in front of the windows because somebody had put a shotgun blast through the windows of the clinic, and they put the sandbags there to protect their patients. So if you can imagine taking your kids to get health care in a building that's behind sandbags with vigilantes circling the block, looking to take action against the Panthers, that's what it was like at that time. We worked with them, got a lot of advice from them. One of the stories that Elmer told me is we wanted to know how to get the equipment they had. They had exam tables and gooseneck lights and all the things you need if you're trying to operate a clinic. And we had none of that, of course. And Elmer said, well, Dr. Green asked us, do you have a truck? And we said, yeah, we can get a truck. And he said, well, at midnight, wheel it around to the back door of this particular wing of the university hospital. And Dr. Green threw open the doors and they unloaded everything they needed from the surplus storage area at the university, and that's how their clinic was equipped. We asked all of these people, what's the area of Seattle that most needs a clinic that doesn't have one? And they said Capitol Hill. So we, 50 years before Zoran Mandami, we went around listening to people. We used that same clever tactic that he used. We knocked on hundreds of doors and asked people, if there were to be a clinic organized, how would you like to see it work? What's important to you? And what they told us probably won't surprise you. They wanted it to focus on prevention and what's now called primary care. They were tired of waiting to go to emergency rooms and then having to wait while, crowded conditions were dealt with by the medical staff. They wanted hours that they could work. Those that had jobs wanted to go when they wouldn't have to miss work because they couldn't afford to miss work, and on with the kinds of concerns that you can imagine you would have if you were trying to invent an ideal clinic. They wanted practitioners who knew their names and knew their children's names and showed that they cared about them. And we took those findings and we called a community meeting around the kind of general sketch that we'd come up with for the clinic. And, we were afraid no one would show up at the meeting. But 70 people showed up that night, including 4 doctors willing to volunteer. And so we set out to find a place to run a clinic. And at that time, the city was so broke they couldn't run all the fire stations. And one of the fire stations on Capitol Hill was unused and vacant. And in a series of meetings, it took a long time to wear us down, but we finally convinced them that empty fire station would make an absolutely great community clinic. And they were trying to figure out how to make it available to us. And finally, they did what was called a mutual and offsetting benefit lease, which simply said you can use the fire station, and in return, you'll provide a certain number of immunizations that the city would otherwise be required to provide. And so that's the way we paid our rent for the first several years that we operated Country Dock. I'll tell just one more story before turning it over to discussion, but operating with volunteers, you very quickly run into healthcare problems that are much too serious for a volunteer clinic operating 3 nights a week. And you need backup services, you need lab, you need X-ray, you need those kinds of things, and you need to have specialists see your patients when you run into real serious problems. So we, at first, called on the county hospital, which was Harborview, and they provided some backup services for the clinics for a time. But then they had recently been taken over by the University of Washington, and the UW was so concerned about the impact of the recession, the Boeing recession, and all the people that were coming to them without any health care coverage of any kind, that they cut off the backup services for the clinics. Now, you can imagine how that was greeted by the clinics. And the Panthers led a demonstration. All of us assembled in the office of the director of Harborview to demand that they restore the backup services. And it got pretty rough. And just at the moment when things were getting pretty heated, a man stood up in the back of the room, a quiet, bearded man, and he said, "My name is Dr. Willard Johnson, and I am the director of the hospital on the other side of the gorge. It's called the United States Public Health Service Hospital, and you probably don't know it because most people aren't eligible to go there. We care for merchant mariners and military retirees and so on and so forth. But I've been reading my regulations, and I found that I can do up to 5% of the service of my hospital for special studies cases. So if we can work it out, I will simply find every person referred from a community clinic an interesting teaching case." And that's the way we started getting backup services from the Public Health Service Hospital. And I think I'll end it there. There are a number of other stories that maybe we can get into later that are kind of interesting.
Thank you very much.
Thank you.
Thank you for sharing with us some of the very logistical organizing, kind of the backbone of what made these clinics. And Teresita, I was wondering if you could share a little bit more about the kind of organizing and material concerns that led into the organizing of ICHS.
So it's so great to listen to Jesus and to Tom, because the movement that we call community health centers really started from all of these different stories of people reacting to injustice, lack of access, and the need for health care. So they both mentioned Larry Gossett, and there were the Gang of Four, who were really very well known. And Seattle is so unique because this Gang of Four really had 4 very distinct communities that bind together, advocate together, demonstrate together, and demand that our communities be served. And what is also, I think, very important to say is that Seattle had redlining. So these communities geographically were split, right? The African American community, or back then we called them the blacks, were in the central area. But somehow Filipinos found their way there, because Filipinos were brown, so they were not Chinese, they were not Japanese. Maybe they're a little black, you know? So we were there. Some Japanese were there too, but they were on the edges of Chinatown. So there's still a Buddhist church where the Japanese were traditionally, and then Chinatown, of course, the Chinese were already there, but Japanese and Filipinos were also there. And then the south end, there were more Asians, the strong Japanese presence, especially in the south end. So what was great about this Gang of Four is we had the Native American, Burning White Bear, we had Larry Gossett, the African American, we had Maestas, Roberto Maestas, who was encamping at a school in Beacon Hill that eventually El Centro de la Raza, owns and has developed into an amazing complex. And then we had Bob Santos, Uncle Bob Santos in our community, who was really inspirational and a focal point for organizing for all of us. And all of us were very scrappy. The story about how the ID clinic is what it was called then, International District, not Chinatown, but International District Clinic, came about because Uncle Bob basically could not find a location for a small clinic. And so he went to one of the owners and he said, I know there's gambling going on behind there, and I'm not going to talk about it to anybody if you let us operate a clinic at the front of the building. And that's how the first storefront clinic came about for the ID clinic. They used, shower curtains to divide the small space so that there's the separated from the public room to where patients were being seen, and the small restroom was also the lab, and we relied heavily back then at the University of Washington students and also Seattle U, specifically medical students at UW and the social work departments of UW and Seattle U. But I also need to say that as scrappy as we were, the resources were very hard, as Tom was saying. And you can't rely on donations when you're a small clinic. So at one point nationally, the public health law included a section on it in terms of creating community health centers. And you had to meet certain standards. You had to have over 50% consumers, so patients, because they wanted to make sure that the clinics were actually meeting the needs of the low income and all that. You can't have selection of patients. You have to accept everybody, and you have to provide a range of services. So it had all these requirements on and on and on, and you have to apply for this funding. And what the funding would bring would be for uninsured care. And Tom was one of the grant writers for a consortium of clinics, which included the ID clinic, to get some federal funding. And that was the first steady source of funding for several clinics. I think it was Country Doc, today's ICHS, ID clinic back then. Neighbor Care was part of it?
Yes.
Yeah.
And
the one in
Carolyn
Wallingford.
Downs.
Carolyn Downs, and also the one in Wallingford, I think, was.
I've got a story about that I'll tell a little later.
Yeah. So Tom really, had his hand in a lot of the clinics, and even though he was focused on Country Doc, but throughout all of this, the hard times, I think the mission to serve, I mean, the heart, the guts, the brains, You talk about being creative. The very first executive director of ID Clinic, basically back in those days, they need copiers, for records and all that. So he would talk to different salesmen. He says, "Oh, don't you guys have a new copier for demo?" And all that, and 2 weeks later, return the copier. He's got another salesman demonstrating another copier. So they were really, very creative and feisty to just keep basic operations going. And at the same time, everybody was like pushing against, the man was determined back then, the government basically to, pound on, we need resources. And I mentioned Kingdom earlier. The community was able to leverage John Spellman, who was a King County executive at that time, to give grant money to start the clinic. And that's how, so from this, wherever we can set up, volunteers going here and there, we were able to get that storefront thanks to Bob Santos twisting that owner's arm, and then be able to at least equip it a little bit. And pay one person who was the manager, because somebody had to schedule volunteers and schedule patients.
Thank you. That's a really fascinating kind of inflection point of, I was thinking about the garnering of federal funds, and what was the organizing that kind of opened those conditions? So when did the federal funds become available, and how did that come about?
Well, maybe I'm going to put Tom's name in this too, because Tom is also involved in CMAR Community Health Clinics. Tom is also, back then, CMAR was really not unlike the IDIC community in the need, and everyone had to be creative because funding sources were absolutely limited. You had to really basically create something because you couldn't afford to buy it. But the thing is this, I really think the underlying aspect of it is determination, is we have to do this. We have to find a way. And if you have the will, there will be a way if you don't give up. And we looked at resources, people like Tom, who was in the mayor's office, who was supportive of CMAR, who saw what CMAR could do for the community. CMAR began because of a Latino need in the community. But CMAR was also one that wanted to support folks who did not have any opportunity for health care. So it wasn't just the Latino community, but it was the premise for it was for the Latino community. But it expanded into a much larger organizationally to serve major populations of the Northwest. So funding sources now, were very limited. We had to figure out where to get some of these funding sources from the state, from the county, and look at where the beneficial value that we could bring back to these agencies, federal agencies, state agencies, and county governments. Because there had to be a connection between what they were giving and what the community benefit was going to be. How was it valued? And so we looked at how we could do that through data and information. We had to do some analytics and some analysis, determine how big that need was, provide that need in terms of costs, and say, could we do it at a lesser cost? Could we handle those that hospitals can't handle or won't refuse to see? Yes, we could. We needed the financial support. So federal government stepped in at that time, so did state and county and local agencies. But it was still a drop in the bucket in terms of level of services. Today now, CMAR serves, had about almost 1.8 million. In 2022, I remember 23, we did almost 1.8 million visits at CMAR of nearly 380,000 patients that came through. Today we see 39% of that is Latino. 67% are people who are uninsured or underinsured. And so we serve everybody and we turn no one down. Anybody that comes in with or without ability to pay, we will see them. We will take losses. But it's important that everybody that walks through that door today, and 13 of our counties that we have in Northwest, are able to be seen and not be turned away. We will not turn anyone away, no matter what the costs. Now, what does that mean in terms of federal resources that you talk about? While there was money flowing to some degree today we're going to see a new change coming.
Yeah.
And that change is something that we have to be prepared about. We'll talk more about that later in terms of what that means. But federal funding sources started to happen in the late 60s, early 70s, that gave us the opportunity for us to grow. So Seymour's ability now for it to grow has, as you said, nearly 150 or so sites, almost 200 sites throughout the Northwest. We have medical facilities, dental facilities. We have almost 20 pharmacies now that we have. We have a Mexican radio station both in the Northwest and Eastern Washington to talk about healthcare, to share the information about healthcare, and to bring legislative bodies to our radio stations to talk about what they're going to do in helping. Because health is and should always be a human right. And we have to figure out how to continue with that program. But federal funding, state and local, will always be a necessity.
Well, I have a very quick story to tell you about the early federal funding. I won't explain why, but I was riding a train back from Washington, D.C. through Canada, and I was reading the congressional record. And in the congressional record, I learned about this brand new program that the great Warren Magnuson had invented called the National Health Service Corps. And none of the clinics at this time had full-time doctors, and we knew that we needed full-time doctors. And this program, the National Health Service Corps, was an ingenious program. It would pay the cost of medical education for a practitioner if they would do 2 years of service in an underserved area. It was designed for rural areas. It wasn't meant for cities. But we knew we were desperate, just like you were saying, and we knew we had a case, and we knew we had people who needed the care. So we set out to change the law. And we had gotten to know Senator Magnuson's folks through the fight to save the Public Health Service Hospital, which is a whole other series of stories that I won't go into. But we now knew a senator's staff pretty well, and we told them, we made our case, and Jerry Johnson, who's still a very well-known lawyer in Seattle, was Magnuson's top aide at that time, and he said, well, you go back to Seattle and you apply for National Health Service Corps doctors under the existing rules. And every time you bump into a roadblock, you call me and tell me what the problem is, because we're going to reauthorize the National Health Service Corps and we want to make some changes. So we set out to do that. We did what Jesus was saying. We did the data analytics. We went through all of that work, and we made our case, and we got the approval of the local health planning council, and we had the local politicians behind us. But in those days, to get National Health Service Corps doctors, you needed the approval of the local medical society. And the local medical society was not enamored of this idea, to say the least, because it was a great embarrassment to them to be that Seattle, with so many doctors and so many hospitals, would be declared a medically underserved area, right? They couldn't countenance that. But we had to win them over. That was the last thing we had to do. And Jerry said, go, get a meeting with the medical society, make your case in person. So we finally got a meeting with the medical society, which they called to meet at the Washington Athletic Club, which was very exclusive at that time. And the delegation that went to make our case was me with my hair down to here, because that's the time we're talking about, right? And Bruce Miyahara, who was the director of the ID clinic at that point, and Elmer Dixon of the Black Panther Party. We went to the front desk of the Washington Athletic Club and they said, if you're here for the kitchen jobs, you want to take this other elevator. But we finally convinced them to let us use the right elevator, got up to the meeting where the medical society was, and tried to make our case, and we weren't getting anywhere. And then somebody came running into the room, a staff person of the medical society, and said, Mr. Byers, there's a phone call for you. It's from Washington, D.C. And the medical society people kind of sat up straight. I think it's Senator Magnuson's office, she said. So I went in the other room and took the call, and Jerry said, how's it going? I said, not very well. I don't think they're going to approve it. And he said, well, wait here about 3 minutes and then go back in and see if the temperature's changed. And I did that, and I went back in, and the call from Senator Magnuson had been enough to get them to change their mind. And we had asked for 4 doctors, and they said, well, we need to make sure that the care is quality, so we'll put a 5th doctor in your proposal as a clinical coordinator. And that's the way the first federal aid came to the clinics.
Yeah, it's amazing.
What grit and political genius to make it happen. Truly. I can't believe we're already at around 7:25. What do y'all say we go a little bit longer and then we open it up for Q&A?
Sure.
Sure.
Okay.
Sounds good.
Thank you. So we're at this point where you're getting federal funding. And what's this kind of, I mean, this must be a kind of long transition period to the level of service that you provide today. But kind of coming from this scrappy, really gritty organizing and then securing funding, and now to today, what was that process like? And what were some of the major challenges that came to each of your clinics?
Well, I'm going to jump in here because one of the things we need to remember is that Washington State is an amazing island, especially these days in terms of support for healthcare. I don't remember the year, Tom, when we actually had universal healthcare in this state. We did for 1 year, and then elections happened, and then the prevailing party turned it back. But out of that emerged what was called the basic health care, which is how the clinics started to grow and be able to do things. So federal funding, aside from the provision of, the National Health Service Corps, where we were able to get doctors, was helpful. But when you have patients who cannot pay, then, the limitations of the federal funds for uninsured care was very, very difficult. It was really very limited. And it's kind of tantamount, to having, you can have rice and beans today, or it's just basics. You can't grow, you can't add services, and the kind of patients we were seeing were complex patients. They didn't just need medical care, they needed dental, and it took many, many years before mental health came into the process. But they also needed supports in terms of housing, in terms of, so they needed additional staff from us to help them navigate daily lives, to be able to be successful, not just healthcare. So basic health, basically, what the state did was target those who are low income, but they did not limit it to citizens only. So it was open to everybody, regardless of status. And so Medicaid took care of those at 100% or below. So then you still had a lot of people who were a little bit above poverty, but still can't afford health care. Their employers didn't provide health care, so they could buy into basic health. And it was subsidized by the state. And for the longest time, that is what health clinics relied on. If we were able to sign up our patients to basic health, then they had some kind of coverage, then we could get reimbursed for something. Not all of our costs, but more costs. But also, just as importantly, if they got hospitalized, basic health helped cover them. So that was the system until we got the Affordable Care Act in 2010. And then we really became much healthier financially because this state is the most aggressive, it's the #1 state in the entire country to have expanded health care. So up to 138% of the federal poverty level for coverage under Medicaid. But then this state also took on up to 400% of the federal poverty level for people to get the tax coverage, the tax premium, rebates and all that. So then we had more people covered. And for health centers, people who in our communities who knew us, who had created relationships with us, stayed with us. There were a lot of people who say, once they have health insurance, they'll go walk. But they didn't. They stayed loyal to us and their families and their friends and the whole communities. So CMAR was able to grow, ICHS was able to grow, Country Doc was able to grow a little bit and build and have their own buildings. And so that is the situation that Jesus is now saying, we're going to lose because of what's happened under this federal administration. Medicaid is being decimated. It's their way of taking away the Affordable Care Act by attacking Medicare. People, starting in January, will lose the tax credits. So a lot of people will indeed lose that coverage, and we are in danger of going back to the old system that Jesus' family faced, which is you only go for health care when you're in dire need and you're in the emergency room, which is the most expensive kind of health care.
That's so true. It is the most expensive kind of health care because now it really is a higher cost to communities, to hospitals, because it is when they're at death's doorstep, there's tremendous amount of health care needs beyond just the basic care. So with CMAR, as Teresita mentions, CMAR organization knew and had understood very well. Again, we do the data analysis, we do the geographic analysis of where things are, how things are in communities. Then we determine what that need looks like and should look like, and then determine how do we get there with funding. But the key thing is this, I think in many ways, is that there has to be a push forward from our leadership. Not just ourselves as community leaders working in communities, but our leadership that we elect. The biggest problem we face is that leaders want to be reelected. They're working hard to get reelected and not working hard to necessarily service the people. I always look at it as, why are they running for office? Because they want to get reelected. Initially, I think a lot of our electeds start off with a passion and a desire to change the world, so to speak, in a positive way. But as time goes on, you forget the purpose along the way. And when you forget that purpose, you become less effective in a community, and you focus on how to get reelected in this position. That's my first concern that I have about our national and local electeds. But I think, as Teresita says, we are facing a somewhat dire future with Medicaid, Medicare, in terms of these issues now, with caps being made, elimination of the tax credits. These are definitely going to put millions of people in a very dire situation where they will not be able to afford health care. We service at least 37% of our, at least 79%, we service a lot of insured and uninsured communities. But of that, also, there's an additional 17% that we service out of that 380,000 folks that we serve that are absolutely have no ability to pay. But in that same vein, we are also servicing insured, and that insured group helps us offset the cost of those that can't afford it. And that's the only way we're doing this in terms of being able to survive and turn no one away. But is that the way it should be? And the answer is no, it should not have to be this way. We shouldn't have to be looking for dollars every time we turn around because the cost of serving a patient is greater than the revenue that we're taking in. So for today, if we have a cap and it's costing us $200 to see a patient, and our revenue generation for that patient is $175, it's costing us $25 to see you, or it's costing us $30 to see you. Yet our doctors stay with us, our nurses stay with us. They know that there's a greater passion beyond just the dollar, but they stay with us. And believe me, we have some of the finest doctors, some of the finest dentists working for us, amazing dental work, amazing doctors that come and work for us, and they work for the community. And they're nobody, maybe a few people know their names, right? But they toil in the field of healthcare in an amazing sort of way that we have to just be very humbled by that energy that they bring into the communities. So we have so many Latino doctors today that didn't exist in the 60s and 70s. We have more nurses, Latinos that have now in our community, dentists who are in our communities, as we have in your community as well. So it's those kinds of things that are happening, but have we made gains? We have. Are we at the edge of losing some of these gains? Yes. Mm-hmm. But I believe these gains are temporal, just like we are temporal in life. This is a generational fight, a generational need that's going to continue. And we will bring back these gains, but it will be a hard-fought gain for the next 4 years. And it's going to be a continuum of generational support from our next generation of communities that are coming before us. And I really believe that we have to set the tone and direction, but we also have to share what that image is. And tonight is one of those, is to be able to share that, to give foundation to the generation that's coming so that they can form their own vision about what changes they can bring and then formulate a plan for them to execute and continue the challenge to bring about that kind of care for us. Because all we want to do, and we've always been wanting to do, is to extend the quality of life for an individual, for a community, and for those that are in desperate need of care. And that's how we believe in our community we need to continue the fight.
2 quick points. One is a great doctor named Abe Bergman that some folks here may have heard of once said to me, a good politician can be worth a dozen doctors. And we lost a great politician in Frank Job.
Mm-hmm. Hear, hear.
Yeah.
Second point I wanted to make is that in this fight that's coming, and it's going to be a huge Donnybrook of a fight, it's no accident the Democrats shut down the government to try to save health care, because health care is going to be the dominant issue in next year's congressional elections. We've got to make the fight now, and the health centers are in a great position to be able to contribute to that fight because they serve the urban poor and they serve the rural poor. Mm-hmm. Our clinics like ours are literally the only healthcare providers in Republican rural districts across the country. And if the clinics can do their share in organizing the way they have in the past, it's going to be really, really a good day for healthcare in America when we show up at the polls on behalf of the kind of healthcare that Teresita and Jesus have been describing.
Thank you. I really appreciate that note of looking ahead and into the future. Teresita, is there anything you would like to leave us with on the note of looking forward and emergent strategies for the fight ahead?
I think Tom is right in terms of how all of us need to be engaged. I mean, this is a huge fight. And remember, this is year one of this administration, federal administration. And, you know, we still have a month to go, a little more than a month to go. And so the power, the fiscal power, is so dangerous for us because we have seen funds diverted without congressional approval. We have seen funds approved by Congress, like SNAP is the more recent example, with billion-dollar reserves, $5 billion in reserves, and also legal fights that have been lost by this administration and it's been told to distribute, and they're not distributing it. So there are people who are privileged, who are in positions of power, who do not have any empathy and probably have, you know, not just disregard, but active hatred for people who don't have enough. So we're talking people of all colors. We're talking of people who are here regardless of status, who are contributing to this economy, who are paying taxes, who are now being held up as dangerous people. And so these are the people that community health centers serve. These are the people that we have embraced regardless of who they are, what their status is, and what healthcare needs they have. And organizing will be a little bit hard because some of them are so afraid of what this administration can do to them. Not just them, but by inference, friends. You know, so they may be here, even if you're here for several generations, you are not safe from being picked up randomly and your ID not being checked and you are disappeared. You know, this has happened over and over again in our communities. So we need everybody, the general public who cares, to be in that fight too. Yes, community health centers can organize. Yes, we have contacts in Congress, but we know that Congress has not been moving, has not been as effective as we would like for them to be. So fear is real. Fear is affecting how people organize and move forward, but we need everybody. And Washington State can't just be the good island.
Yeah, I totally agree with that, Teresita, in your perspective. I think, you know, I brought this little note because I keep it in my office. I've had it for, I don't know how many years, maybe 40 years of work, kind of dating myself. But John F. Kennedy said many years that there are risks and costs to a program of action, but they are far less than the long-range risks and costs of comfortable inaction. And so it's not so much as important who we are in the community. What's important is what we do in our communities. And that's what's really the basis for which we need to keep looking. What is it that we're going to do? What is it that's driving those that are out there listening to us or those that are here tonight? What is it that you can pick up from this conversation tonight that hits you in your heart, in your spirit, in your senses, that says, I can do this? Because this is what we need, is a continuum. As I said, it's a generational fight. This is not just today and tomorrow, but it's the future. And as we move towards the future, at some day and some hope in our vision is universal health care, is care for everyone, and the quality of life for communities and individuals is really the goal. But we have to start with a foundation, build the vision, plan it out, and then work towards it with groups of the same notion and the same ideals.
Well said. You know, one of the bright spots of the situation we're in is they've wrecked the government so badly that it's got to be built back differently. We've got a chance, because I'm convinced we're gonna win those elections, and the day will come when we're not answering to Trump and not afraid of masked thugs taking our neighbors away. The day will come. Yeah. And we've got to be ready to build these systems back better. Why is it that the American people spend 24 cents of every healthcare dollar on paperwork? Why is it that we put up with that when Canada only spends 8 cents of their healthcare dollar and Medicare only spends 3 cents of every healthcare dollar? We can do better and build these systems back better so that they serve people the way that we've tried to describe tonight.
Thank you so much. This was really inspiring, and we truly stand on the shoulders of giants. Thank you all for the work that you've done and continue to do.
Thank you for having us.
Yeah.
My pleasure.
Thank you for having OGs around.
Truly our pleasure.
If I may just want to add, I really want to emphasize what Tom said about a hero in our community with Frank
Yeah.
Chop.
Yes, absolutely.
You know, he was an amazing angel in our community. And it just reminds me it reminded me of a song that I sing to my wife, that she's been gone. I sing it almost weekly. Once a week I sing it to my wife. She passed away a few years back, but he was an amazing spirit in our community that did so much for so many people tirelessly. Amazing to me.
He was an archangel.
Yeah.
Yeah.
May he rest in
Thank you
peace.
for bringing Frank Chop
Yes.
back up.
Yes.
I also had long hair once.
I still do.
I'd love to open it up for some audience questions before we wrap here.
Sure.
If you all are feeling up for it, if you could raise your hand, I'll bring the wireless mic over to you.
Just a thank you. One is thank you all. The people you've talked about, I've read about, and I would like to recommend for people who haven't, the Four Amigos, which talked
Yes.
about how cross groups work together to achieve what is best for all. And anybody who hasn't read it, look up Four Amigos. And third, I am a product of the Open Door Clinic in the university. Back in 1970, that was the only place I could get or would even go to get health care. And they served me, and they made me feel like I deserved it. And I think that's the importance of health care.
Yeah.
Thank you.
You mentioned something that was very optimistic, but only lasted for 1 year, and that was the universal health care. Can you tell us a little bit about how on earth that happened, and then how it went away so quickly, and if there's hope that that could ever come back?
So I know this by lore, so maybe Tom could help. So Jim McDermott is still around, and he certainly was a big advocate and proponent for it. And Mike Lowry was also, he was governor at that time. So Jim, I believe he was in charge of the Senate Ways and Means Committee at that time when they made it happen. And so everybody was happy, as I understood it, but of course we lost it very quickly during elections. So elections do matter. The people who are in office do matter.
Piggybacking on that question, I wonder what would the benefits be to having a completely state-funded healthcare system versus one that relies at all on federal support. Is something like that possible? Would it be, is that what we should be trying to work for? Is it too pie in the sky?
Well, I guess I can say, just to start off with this kind of note, the state itself today, for example, is looking at a $250 million deficit in the next 2 years, and about a $65 million deficit just in 2026 coming up. When they're looking at these kinds of deficits, you know, you're thinking about, okay, yes, it would be wonderful if the state could handle it, but I'm going to maybe sound a little negative about it, but when you think of all the taxes that we're paying now for a number of things that the state does, we're one of the highest taxed states in the country, we would have to tax more. I would say we would have to take a look at what the taxes that we have and determine, reprioritize those dollars. And then before we even take a look at increasing more taxes. But I think we really need to do an evaluative kind of analysis of where are every penny that we spend in taxes, and then figure out how we could move some of those dollars into healthcare as a top priority in the state of Washington. Because I know that, as Tom says, we're spending an awful lot of money, 25 cents, did you say? 24 cents on just paperwork. Seriously, we really need to take a look at where our dollars are really going, and then reprioritize those dollars to see how much we can fund healthcare in the state of Washington, because I think it's the way to go.
I was going to say essentially the same thing. You can't have universal health care without a tax structure that supports it. And right now the money is going to Washington, D.C. And we're, as Jesus pointed out, having a tough time generating the state revenues to do what Frank and other people have set out to do.
But it's doable. I think we can't give up. We have to be looking for it. We have to keep that perspective in mind, to say it's doable, and how do we get there? Because if you think about how Tom started off and how we got there, or how Simar with Rogelio Riojas, our CEO, how he got here, and Teresita and her community, how they got here, it was doable even though it was against all the odds. So it is doable in the state of Washington.
And we're partway there. Washington's children are more likely to be insured than any other state in the union. And that's because Frank and his legislative partners set out a dozen years ago, and they boldly proclaimed that by year 2012 or whatever it is, I forget, all kids are going to be covered. And at the time, they had no idea how they were going to pull that off, but they asserted it, and it came together. And now I think, what is it, 97, 98% of the kids in Washington are covered, including undocumented kids. Don't tell Trump that.
Yeah, but I do think that a full frontal effort has to be made to try and save the Affordable Care Act.
Yeah.
You know, to me, healthy kids are important, but if their parents are not healthy, if their caretakers are not healthy, and in our communities, many grandparents are the caretakers and the child rearers. Not a word, I don't think. But it's everybody has to be healthy. Everybody has a right to be healthy. And that's the basic premise that all three of us are here for. And yes, it's not possible for this state to carry the burden of all that cost. But when you think about it, this society is still very mobile. So trying to take care of just our own will not be effective because people will move in and out. And so the federal participation is so important. And, you know, this president talks about, oh, we'll just send the money back to the states, and they can spend the money whatever way they want. Well, but they're also doing things like, you know, monkeying with the census. And the way federal appropriations happen is based on the census, based on how many people you have in your state. So the more they undercount our state, the more they undercount the populations that we care about, the less federal money we will get. So it is a whole picture fight, that whole picture advocacy that we're going to have to go after. But I totally agree with Tom. This is an opportunity to build systems that are better, that cover more, that costs less in terms of administration, and that the money goes to the benefits.
I just wanted to thank you again. You're all heroes in every possible sense of the word. The stories that you've told and the history you've shared has been so inspiring. It's so empowering. I know you're all still very, very busy in your lives. And I also know that in all your lives you've done other amazing things. We'll have separate programs for all the other things you've done. Have you guys ever thought of, or are you in the process of in any way recording your histories or working with people to save these stories? Because I'm so glad we have tonight. But the lessons that you have in your lives, both through the healthcare, but all the other things you've done that have totally made our community better, contain so many lessons for all of us going forward. So I want to thank you for that and encourage you to consider saving those stories.
Thank you.
Oh. Well, actually, Bruce Miyahara, Jack Thompson, David Loud, Jill Marsden, and I were, before the pandemic, working on a book about the history of the community clinics. And we were teaming up with HistoryLink to try to do it, but when the pandemic hit, you know, we kind of stalled out, to be honest about it.
Yeah, there's been, it's interesting, part of my background or part of my, I guess, hobby is music. So I actually have been playing since I was 12. And so some of my music actually is songs about farm workers. Songs that I've actually dedicated to Roberto Maestas, what I was asked to do for him, and I did a song that I wrote about farm workers. But also that's part of the history, is through music. The other is we have a Latino museum in Seattle, which is the Seymour Museum. It's a huge museum. Yeah. And a lot of our history, a lot of similarities of what I've just shared are written in the museum at the university, at Seymour Community Health. And we continue to expand and continue to grow, because that was really the premise that you talk about, is that these contributions have to have an impact in our community. And these contributions relate to what these communities, these folks did when they first came to the state of Washington as Latinos, as immigrants from Mexico, like my family, and how we traveled and how we got here, what happened and how it happened. And also healthcare becomes a part of that. But I also want to leave you with healthcare. What does healthcare really mean? And healthcare isn't just the well-being of the body. Healthcare is also the well-being of where you reside. You cannot just get medication and recuperate in a car or in a tent. We have to provide affordable housing as part of healthcare. We have to provide education as part of healthcare to break the cycle of poverty and to educate and to be self-sufficient and sustainable for our younger generation. It is really more encompassing than just the fundamental basic healthcare that we need. Those are the three-legged stools that we look at and say we need to have these things as fundamental in healthcare. But yes, our stories have to stay, because that's what gives us the foundation for the next group. It's going to continue.
So there's a first 25 years. So It's over 50 years old now, so we need to focus on getting the next chapters, and there are actually people nagging me to get started on it. So yes, there will be. The stories are so different and yet the same. And the struggles are so different and yet the same. And the bottom line is that, love of service to the community. ICHS started with Chinese and Filipino patients. Today, they have close to 80 different languages, so not just the Asian languages, but East African, Eastern European, responsive to the communities that the clinics are located in. So it's ever evolving, but the need never stops.
Thank you. Thank you so much.
Thank you.
Thank you.
Thank you.
This was really special. And if anyone would like to revisit tonight's recording on the MOHAI YouTube channel, you can definitely check out the stories there. We have other History Cafe as well on that channel. Before you leave tonight, if you wouldn't mind helping MOHAI out by filling out one of our lovely surveys. We have not sold in stores, never before seen postcards available for you as a thank you. And if you would like to consider being a MOHAI member, we would love to have you, and it also makes a great gift as we approach the holidays. And finally, this is our last History Cafe of the year. We are so honored to have you. And if you would like to come back in January, on January 21st, we will be hosting History Cafe, the Nisqually Quake, and Fixing the Bricks. So we look forward to seeing you then. That sounds great. Thank you again.
Thank you so much.
Thank you, everyone.
Thank you.
That was fun.
Thank you. It's always good to see you.